Senate File 296 is, quite frankly, the single most significant opportunity we have had in this state and every other state of improving the health of our constituents by ensuring access to quality, affordable health care. With that, Mr. President, I believe that the House has amended our bill, and I would ask that you call that up at this time.
We will now call up the House Amendment 3210 to Senate File 296. You are in order for opening comments on the Amendment 3210.
Thank you, Mr. President. Mr. President, members of the Senate, this has been an issue that we have been dealing with throughout, just not through this session, but actually started already last summer. So first I'm going to tell you what my motion will be, and then I'm going to tell you why I'm going to ask you to vote no. The motion has to be that, that I would move and ask the Senate to concur in the House amendment, and I am going to ask you to vote no for these reasons. First of all, in order to get a good sense of where we're at, I'm going to do a little comparison here, so bear with me. First of all, the Senate plan and the House plan are very similar. We agreed that it is time to change how we deliver health care in this state. And both bills acknowledge that, recognize it, and we are shifting from a fee-for-service payment system. In other words, the more a doc or a hospital sees you, the more they get paid, fee-for-service. We are getting rid of that. We are moving away from it, and we are moving to an integrated health system that says you will be paid, health providers, by the health outcomes of the patients. We are shifting our direction. We are going to be focused on wellness and prevention. We will be doing that through the establishment of accountable care organizations and medical homes. Both bills contain similar provisions on that. Agreed. Done deal. It's been that way since the very beginning. Here's the differences. The Senate bill will cover 150,000 Iowans who earn up to $15,300 a year household income. Who are they? They are adults between the ages of 19 and 64. They are working. They just happen to be in a job that pays a low wage and offers no health benefits. Nor do they earn enough money to buy it on their own. So the Senate plan was covering 150,000 Iowans up to $15,300 of household income. The amendment before us that came over from the House will ensure Iowans up to $11,000 of income. 89,000 Iowans, and then it has a whole set of provisions on co-pays and premiums. They don't call them premiums, they call them some kind of a membership agreement for people that are earning less than $11,000 a year. Now that group of Iowans that lives in our districts, that work hard every day and play by the rules, that earn between $11,000 and $15,000 a year, somehow they're going to go into an insurance exchange program where they've got to pay a certain percent of their income in a premium. Let me tell you right now, very simply, that is a barrier. It is a barrier for access to health care. If they could afford it, they'd have it now. Now think about that. Someone who earns $15,000 a year and they're trying to make ends meet. When you take out Social Security tax and Medicare tax, they're living on about $950 a month, paying rent, making their house payment, paying utilities, etc. Let's face it, folks, they don't have a lot of money left. In fact, most of them have nothing left, and they're barely making it, if at all. Now let's look at financing. On the Senate plan, the federal government has already said through the Affordable Care Act, and again, I will repeat, pay-as-you-go rule that was in effect at the time that the Affordable Care Act was enacted. They have eliminated that since 2010. But pay-as-you-go said you need to find, if you're going to create a new program, you have to identify how you're going to pay for it. So that means that right now, we are all paying for that through our federal taxes and other provisions in that bill. Paid for, okay? The cost to the state from now until 2016 is zero because we are already paying for it. Federal government's paying 100%. Starting in 2016, it drops. The state pays 5%. Federal government pays 95%. And by 2020, the state pays 10% of the cost. Federal government pays 90% of the cost. And it continues in that manner. Now, I've heard, well, you know, we can't trust that federal government. I will repeat one more time. Medicaid has been the law of this country, an entitlement, for 50 years. Never has the federal government reneged on Medicaid. Has not. 3 entitlement programs in this country: Medicaid, Medicare, Social Security. Has not reneged. Has it reneged on other promises? Sure. And quite frankly, we could look in the mirror and say, so have we reneged on some promises we've made. We've been trying to make good on them as time has gone on and our economy got better. But yep, states reneged on some of its promises as well, but not on Medicaid. Financing. Talked a little bit about the financing in Senate File 296, so now let's talk about financing in the amendment before us. It's going to take $162 million in state money to pay for this plan under 3210 versus zero. Where's the money come from? Well, first they're going to scoop $42 million from Polk County taxpayers that they're currently being taxed to support Broadlawns. Then Polk County taxpayers, as well as all the rest of the 98 counties, will have to contribute $44 million of our mental health property tax dollars to support that plan. And then they're going to take $13 million from the University of Iowa hospitals to pay for that plan. Think about that. So what that means is that it's 100% for the next 3 years, and by year 2020, 10% state, 90% federal. But under this plan, it's 42% state, 58% federal from this day forward. You really want to tax your constituents on property taxes to pay for this? Really? You really want to do that? Because that's what you're going to do if you vote for this amendment. That's what you're going to be doing. And you're also going to be excluding about 60,000 Iowans who would have had health care and access to it and been able to get on the path of a healthy lifestyle. And they will be denied because once you start putting all those premiums and co-pays and deductibles, you have just put up barriers that prevent them from getting the care. We have $1 billion a year in this little state of uncompensated care at our hospitals alone. And I know everyone in this room has been contacted by your hospital administrators and others. So what does that mean for those of us who are fortunate enough to have health insurance? What that means is that we are paying about $1,000 or more a year in our premiums to help cover some of the costs of Iowa's uninsured. Under 296, that starts going away. You no longer have that exorbitant, uncompensated care at our hospitals anymore. And then finally, under our plan, Iowa's small business owners will not be penalized for not providing health insurance for their employees in that wage range, because they're going to have insurance under Medicaid expansion. But under 3210, businesses in this state will have an additional fee of about $24 million. Think about that. Bottom line, end of 3 years, when we're set 0, 100% for the state under 296, the total cost of state funds by the third year cumulative is $10.9 million, federal funds $1.3 billion, total $1.3 billion, $45 million under 296. Bottom line, end of year 3, under 3210. Total, $2 billion, $1.6 million. What's the difference? $656 million more under 3210. State funds, total cumulative over those next 3 years, $403,620,000. $267 million more than what we would have to spend by year 3 cumulatively under Senate File 296. You think about it. I'm asking you to vote no, not to concur in the House amendment. Thank you, Mr. Speaker, Mr. President.